EMTT, extracorporeal magnetotransduction therapy. This heals all kinds of stuff. I've seen people say, oh, it's only any good on the hip. That's because the only place you really feel it is on your hip, your SI joints, and maybe your shoulder. Very, very few people feel this elsewhere. So here's an important factor that you must do. When the patient comes in and they've agreed to EMTT, put it on them for a second, switch it on, they don't feel anything, no problem. Stop it after about 100 pulses and go, it's going to show you the energy that this machine produces. And you get yourself a ring of paper clips. I've shown many of you this before, and we get that amazing firework sensation that comes off. The people usually jump back and go, wow, I didn't expect that. And they get an idea of the level of power that this is producing. Another good way is actually scan their shoulder, scan their sacroiliac joint, scan their anterior hip, and show them that you can feel it. But it's just that on their knee or their ankle or their hand, they're not going to feel anything, but that doesn't mean the power isn't there. Now, a few things to understand about this. This, we believe, is literally opening up those ionic channels in your cells, and that makes them more susceptible, more receptive to things like shockwave therapy and the mechanotransduction and the stem cell activation and differentiation that we get from shockwave. So I do like to, where possible, use this first to kind of get the patient going. Also, we know it takes 90 days for shockwave to really work and make a difference on our patients. So if we use this as well, the reduction in pain and inflammation normally gives them an early feeling, like straight after session 1, of well-being and less pain. And you have to make sure that people understand that is down to the EMTT. Let's give it the value it deserves and talk about it in the right way. And what we're doing is we're filling in that gap of time whilst we wait for proper real focus shockwave to start doing its thing. But this has got so much more to offer, and I think that the effect that I've had on broken fingers, the effect I've had on the feet, particularly when it comes to bunions, is huge. One session and the bunion pain is reduced by more than 50%. You do the full course of 6 over 3 weeks, and pretty much bunion pain gone. So far, most of my patients for at least a year before they need to have it re-looked at. Stress fractures, stress responses, fractures, bone injury, recovery from surgery. This can do a whole manner of things for you that can't be done with other pieces of equipment, or at least much more difficult. And by the way, it's hands-free. It's hands-free. So the ability to treat a patient on the ankle with this, whilst you treat the shoulder with shockwave, incredible. You reduce down, or at least don't extend your treatment time, and you've got 2 things working at once. Because how many patients actually come in, get out of my way, how many patients actually come in with just one problem? They might book in for one, but by the time they come in and they're paying your fees, they want to make sure they get a couple of things done. So you can actually treat both areas without extending your treatment time. This bad boy here is an amazing piece of kit. And if you haven't made the jump to get it, then I significantly suggest that you either look at it, ask to borrow one, see the effects yourselves, even if it's on your own body, your own ailments. I use this before and after every basketball game on my dodgy knee, which I've spoken about a lot. And honestly, I'm painful. I mean, listen, you don't take it from me. Borrow a machine or buy a machine, find out for yourself. It's amazing. Okay.